Hi, I'm Jennifer Nichols, Interim President at Johns Hopkins Bayview Medical Center and past co-chair of Go Red for Women in Baltimore. Welcome to the Red Chair Series. Today, joining me, I have Dr. Erin Michos. Dr. Michos, welcome.
Thank you so much for having me on this program.
So tell us a little bit about what you do at Johns Hopkins.
I'm a cardiologist that focuses on prevention and women's cardiovascular health. So I both see patients in my women's cardiovascular clinics, but I also have some research grants, including those from the American Heart Association, to do research to understand risk factors of cardiovascular disease in women and how women's heart health is different than men's.
I also understand a big part of your practice is cardio-obstetrics. Can you tell us a little bit more about that?
Yeah, so cardio-obstetrics is a relatively new field. It's understanding the intersection between cardiovascular disease and pregnancy. So how pregnancy can affect heart health and how heart health can affect pregnancy. And of course, it's important because our goal is not only to have a healthy mother and a healthy baby, but also women's heart health, years later, even decades after their pregnancy, they may be at increased risk for cardiovascular disease if they've had an adverse pregnancy outcome, such as preeclampsia or gestational diabetes.
So are there any other type of symptoms that women who are pregnant should be thinking about?
So pregnancy can potentially unmask cardiovascular disease or heart disease that women might not have been aware that they had. But if someone has known heart disease, such as congenital heart disease that they may have been born with, potentially pregnancy can exacerbate that. And so for women who have known heart disease, it's really important for pre-pregnancy counseling and collaboration between cardiology and maternal fetal medicine and obstetrics to kind of plan for pregnancy and help have the best options for mother and baby.
What inspired you to choose cardiology as a profession?
So much of cardiovascular disease can be preventable. Really attracted me. I was very interested in diet and physical activity and the importance of healthy lifestyle. People have risk factors and we try to prevent them from developing cardiovascular disease. And so these risk factors are what I was talking about, not only the traditional ones like blood pressure and cholesterol, but also these unique female-specific factors that women don't get asked about, such as early menopause and did they ever have a pregnancy that with a complication like preeclampsia. One of the biggest risk factors for having an adverse pregnancy complication like preeclampsia or gestational diabetes is starting pregnancy in poor cardiovascular health. So having chronic hypertension or being overweight or obese. So really trying to optimize women's heart health, throughout the lifespan, pre-pregnancy, during pregnancy, and beyond is so important.
And it's not just an investment that you have to make when you have an adverse event. It's a daily investment, to your point, around prevention, so that hopefully you don't actually have one of those adverse events.
Right. Prevention works best when delivered early. So we can always treat later, when we find disease, but it's more effective when we treat early. Following a healthy diet, getting regular physical activity, getting good sleep. The more of these factors that you have that are healthy, that confers more likelihood that people don't develop complications during pregnancy, but ultimately they don't develop heart problems later in life.
Well, and it's interesting because so often we think of heart disease as a disease of the aging, right? Not necessarily younger women who are of childbearing age who are thinking about getting pregnant.
Yeah, so unfortunately, heart disease is on the rise in young adults and particularly in young women. So actually the fastest growing heart disease rate is in middle-aged women. Women are often so focused on taking care of everybody else in their life that they may not be prioritizing their own health. If their doctors haven't asked them about their reproductive history and they have some of those red flags, then yes, they should bring it up because that might be a marker to start preventive therapies such as statins earlier, or at least do some additional tests to see if they're at risk for heart disease. As a woman, I feel like I can relate to a lot of what my patients are going through, and it's just a pleasure to be able to do this for my career.
I, for one, am just so thrilled that you're in academic medicine and that you're at Johns Hopkins, and that you are taking care of so many female cardiac patients, and just the research that you do to try to advance the field. Thank you.
Thank you so much again for having me on your program.